think social determinants of health are very, very impactful in a person's ability to be able to get to goal. And I think a lot about that when I'm thinking about how expensive it could be to manage a condition like diabetes. When you think about the number of appointments that you have to keep just to stay within the standards of care. So an eye exam, for example, checking your feet, having nutrition counseling, even screening for depression or anxiety. That's just the medical piece of it. And then you start thinking about the supplies that are required to manage diabetes effectively, and then the medication. It can become a very expensive condition very quickly.
And so when we think about patients having sort of suboptimal therapy, our patients, it's really more than just medication and dosage, because taking care of them includes a variety of factors. And that is, the medication and monitoring is one piece of that, but it's also access to healthy and regular foods, it's exercise, it's stress management, and patient education. And so when we think about that, our patients are impacted by all of these factors.
Having the ability to get to the appointments that you that are going to help you better manage your diabetes, helping to get to the pharmacy to pick up your medications, helping just to get around to get groceries and things. I think, transportation is a big one, and we try to help overcome that by offering free delivery in our service area.
Are the patients that we're working with, the people with diabetes that we're working with, are they living in food deserts? Do they not have access to foods, or only highly processed foods? They're really kind of looking at access for that. Also, looking in terms of medication and affordability for medication. If we see that somebody's lost their insurance, that they've changed insurance plans and now they have a high deductible plan, so the cost and the affordability, I think in terms of social determinants of health, also, do they have a support system in place, or are they isolated and alone?
The other problem we have is the nutrition piece. A lot of the nutritional materials that we've seen that our patients receive are general, and it's really not culturally sensitive to our patients' diet. So those are some of the challenges as they try to, eat the proper things, try to make the proper foods. Some of the advice just isn't correlating with their daily living.
I have a set of questions essentially that, are tied into social determinants of health to see if they would benefit from additional resources. I'm asking patients about food security. I'm asking patients if cost is a concern for them, if they have any, religious beliefs that affect how I care about them.
I think so often in my experience has been people with diabetes really want to do well in managing their diabetes. And I've learned to really assess, are they in denial? Are they burned out from living with diabetes? Are there other challenges in life, particularly mental health, that are making it difficult to manage your diabetes? So look at that person with diabetes as a whole person, and let's not label them, because they're a person living with a disease that impacts every area of their life, day in and day out. And we as a pharmacist can be their advocate. We can be support and be their go-to team member in the day-to-day living with diabetes.